Hello, it's Dr. Rhonda Johnson, and today is Tuesday, November 17th, 2020. And today I'm going to be talking about young people between the ages of 18 and 29 and COVID-19. You know, yesterday I read an article from the LA Times that said that people are seeking ways to to hold parties. They're trying to be responsible. So what they've been doing is getting tested for the coronavirus as a way to clear themselves to go to parties without needing to wear masks or keep their distance. Well, folks, that's not a good idea, because I'm here to tell you that you can have a negative COVID-19 test and you can still be at risk for getting COVID-19. A negative COVID-19 test just means that you are negative when that test was done. See, a person who is tested shortly after becoming infected, but before the virus has reproduced enough copies of itself, could have a negative COVID-19 test, and that's called a false negative result. Or you can have a person be exposed to the virus just after getting a test on a Thursday and be contagious by the time they have the party on Sunday and infect everybody at the party. Remember that 40% of coronavirus infections are asymptomatic. 40% is a big number. That means a lot of people are infected with this virus and highly contagious, but never show any symptoms of illness. That's why temperature screening is not that effective, folks. Well, we know that looking at the data of COVID-19 infections here in the United States, that there is a big jump in all age groups, but an alarming jump among young adults. And in many parts of the country, young adults between the ages of 18 and 29 are driving the spread of this pandemic. So, as I said, what a lot of times happens that the adults, young adults 18 to 29, are getting infected. And then the next wave is adults 30 to 45. Now see, people between the ages of 18 and 29, if they get COVID, sometimes they do just fine. They don't have more than a mild cold. But adults between the ages of 30 to 45 are much more likely to have symptoms. And then the folks that they pass it to, the 55 and up, are highly likely to have more chronic diseases. And these are the folks that end up in the hospital, in the ICUs, on the vents, and sadly, the ones that die. You know, right now we have 73,000 people in the hospital with COVID-19. And do you know how many mothers, fathers, sisters, brothers, grandparents, aunts, uncles, cousins, sons, and daughters have died? Well, right now, at this moment, the number stands at around 240,000. Now, things would look so differently if everyone would just follow some simple prevention protocols. We all know what they are. Those are the hand washing and the wearing the mask in public and staying 6 feet apart or more and staying home when sick and avoiding large gatherings of 10 people or more outside your household. You know, COVID-19 now is the second leading cause of death in the United States. So, as always, I try to offer a little bit of advice so people can stay alive during this pandemic. So if you are 55 and up, or if you have any type of chronic condition, if you have young people in your home who are between the ages of 18 to 29, talk to them. Get a sense of how interactive socially they are. And if you're concerned about staying alive or lowering your risk of getting COVID-19, then you may want to take some steps of self-defense. And that includes wearing a mask inside your home whenever your young people are around. That includes staying as far apart as you can. And don't share eating or drinking utensils if they're not clean. It also includes opening up those windows periodically to allow for cross ventilation and keeping high-touch surfaces clean. So, folks, we've got to do everything that we can to stay alive this pandemic. My views are my own. I wish you the best. Stay safe, stay protected, stay on the defense, and have a blessed day.